Pulmonary Circulation. Chapter 119. Pulmonary blood vessels. Pulmonary blood vessels include pulmonary artery, which carries deoxygenated blood to alveoli of lungs, and bronchial artery, which supply oxygenated blood to other structures of lungs, see below. Pulmonary artery. Pulmonary artery supplies deoxygenated blood pumped from right ventricle to alveoli of lungs, pulmonary circulation. After leaving the right ventricle, this artery divides into right and left branches. Each branch enters the corresponding lung along with primary bronchus. After entering the lung, branch of the pulmonary artery divides into small vessels and finally forms the capillary plexus that is in intimate relationship to alveoli. Capillary plexus is solely concerned with alveolar gas exchange. Oxygenated blood from the alveoli is carried to left atrium by one pulmonary vein from each side. Bronchial artery. Bronchial artery arises from descending thoracic aorta. It supplies arterial blood to bronchi, connective tissue and other structures of lung stroma, visceral pleura, and pulmonary lymph nodes. Venous blood from these structures is drained by two bronchial veins from each side. Bronchial veins from right side drain into azygous vein and the left bronchial veins drain into superior hemiazygos or left superior intercostal veins. However, the blood from distal portion of bronchial circulation is drained directly into the tributaries of pulmonary veins. Physiological shunt. Definition. Physiological shunt is defined as a diversion through which the venous blood is mixed with arterial blood. Components. Physiological shunt has two components: flow of deoxygenated blood from bronchial circulation into pulmonary veins without being oxygenated makes up part of normal physiological shunt. Flow of deoxygenated blood from Thebacean veins into cardiac chambers directly, Chapter 108. Venous admixture and wasted blood. Physiological shunt results in venous admixture. Venous admixture refers to mixing of deoxygenated blood with oxygenated blood. Fraction of venous blood, which is not fully oxygenated, is generally considered as wasted blood. Normal shunt level and its variations. Normal physiological shunt of venous blood to the left side of heart is 1% to 2% of cardiac output. In normal persons, it may increase up to 5% of cardiac output, which may be due to mismatching of ventilation-perfusion ratio within physiological limits. Pathological increase in the shunt occurs in several conditions such as acute pulmonary infections and bronchiectasis, permanent dilatation of bronchi due to chronic pulmonary infections and inflammatory processes. Physiological shunt vs. physiological dead space. Physiological shunt is analogous to physiological dead space, Chapter 122. Physiological shunt includes wasted blood and physiological dead space includes wasted air. Both wasted blood and wasted air exist on either side of alveolar membrane and both affect the ventilation-perfusion ratio, Chapter 122. Characteristic features of pulmonary blood vessels. Following are the characteristic features of pulmonary blood vessels. Pulmonary artery has a thin wall. Its thickness is only about 1/3 of thickness of the systemic aortic wall. Wall of other pulmonary blood vessels is also thin. Pulmonary blood vessels are highly elastic and more distendable. Smooth muscle coat is not well developed in the pulmonary blood vessels. True arterioles have less smooth muscle fibers. Pulmonary capillaries are larger than systemic capillaries. Pulmonary capillaries are also dense and have multiple anastomosis, so, each alveolus occupies a capillary basket. Vascular resistance in pulmonary circulation is very less, it is only 1/10 of systemic circulation. Pulmonary vascular system is a low-pressure system. Pulmonary arterial pressure and pulmonary capillary pressure are very low, see below. Pulmonary artery carries deoxygenated blood from heart to lungs and pulmonary veins carry oxygenated blood from lungs to heart. Physiological shunt is present. Pulmonary blood flow. Lungs receive the whole amount of blood that is pumped out from right ventricle. Output of blood per minute is same in both right and left ventricle. It is about 5 liter. Thus, the lungs accommodate amount of blood, which is equal to amount of blood accommodated by all other parts of the body. Pulmonary blood pressure. Pulmonary blood vessels are more diastensable than systemic blood vessels. So the blood pressure is less in pulmonary blood vessels. Thus, the entire pulmonary vascular system is a low-pressure bed. Pulmonary arterial pressure. Systolic pressure, 25 mm Hg. Diastolic pressure, 10 mm Hg. Mean arterial pressure, 15 mm Hg. Pulmonary capillary pressure. Pulmonary capillary pressure is about 7 mm Hg. This pressure is sufficient for exchange of gases between alveoli and blood. Measurement of pulmonary blood flow. Pulmonary blood flow is measured by applying Fick principle. Details are given in Chapter 98. Regulation of pulmonary blood flow. Pulmonary blood flow is regulated by the following factors: cardiac output, vascular resistance, nervous factors, chemical factors, gravity and hydrostatic pressure. 1. Cardiac output. Pulmonary blood flow is directly proportional to cardiac output. So, any factor that alters the cardiac output also affects pulmonary blood flow. Cardiac output is in turn regulated by 4 factors: venous return, force of contraction, rate of contraction, peripheral resistance. 2. Vascular resistance. Pulmonary blood flow is inversely proportional to the pulmonary vascular resistance. Pulmonary vascular resistance is low compared to systemic vascular resistance. Pulmonary vascular resistance is altered in different phases of respiration. During inspiration, pulmonary blood vessels are distended because of decreased intrathoracic pressure. This causes decrease in vascular resistance, resulting in increased pulmonary blood flow, Fig. 119.1. During expiration, the pulmonary vascular resistance increases, resulting in decreased blood flow. During the conditions like exercise, the vascular resistance decreases and blood flow increases. It is influenced by the exercise-induced hypoxia and hypercapnia. 3. Nervous factors. Stimulation of sympathetic nerves under experimental conditions increases the pulmonary vascular resistance by vasoconstriction, and the stimulation of parasympathetic, i.e. vagus nerve, decreases the vascular resistance by vasodilatation. However, under physiological conditions, it is doubtful whether autonomic nerves play any role in regulating the blood flow to lungs. 4. Chemical factors. Excess of carbon dioxide or lack of oxygen causes vasoconstriction. The cause for pulmonary vasoconstriction by hypoxia is not known, but it has some significance. If some part of lungs is affected by hypoxia, there is constriction of capillaries in that area. Thus, blood is directed to the alveoli of neighboring area where gaseous exchange occurs. 5. Gravity and hydrostatic pressure. Normally in standing position, blood pressure in lower extremity of the body is very high, and in upper parts above the level of heart, the pressure is low. This is because of the effect of gravitational force. A similar condition is observed to some extent in lungs also. Pulmonary vascular pressure varies in different parts of the lungs. Apical portion, Zone 1. Normally, in the apical portion of lungs, pulmonary capillary pressure is almost same as alveolar pressure. So, the pulmonary arterial pressure is just sufficient for flow of blood into alveolar capillaries. However, if pulmonary arterial pressure decreases or if alveolar pressure increases, the capillaries are collapsed. This prevents flow of blood to alveoli. So, this zone of lung is called area of zero blood flow, Fig. 119.2. Under these conditions, there is no gaseous exchange in this zone of lungs. So, it is considered as the part of physiological dead space, which is ventilated but not perfused. And, the ventilation-perfusion ratio increases. It may lead to growth of bacteria, particularly tubercle bacilli, making this part of lungs susceptible for tuberculosis. Mid-portion, Zone 2. In the mid-portion of lungs, the pressure in alveoli is less than pulmonary systolic pressure and more than the pulmonary diastolic pressure. Because of this, the blood flow to the alveoli increases during systole and decreases during diastole. So, this zone of the lung is called area of intermittent flow. Ventilation perfusion ratio is normal. Lower portion, zone 3. In the lower portion of lungs, the pulmonary arterial pressure is high and it is more than alveolar pressure both during systole and diastole. So the blood flows continuously. Hence, this part of lungs is called area of continuous blood flow. Ventilation perfusion ratio decreases because of increased blood flow.